Hi, I'm Dr. Barthen, and I'd like to talk to you about irritable bowel syndrome, colitis, and Crohn's disease. Now, I've been a doctor of chiropractic for 30 years, and for the last 5 years I've been a student of functional medicine, which is the treatment of chronic medical conditions without the use of drugs. And I've been studying under Dr. Michael Johnson, who's an author of a number of books. What Do You Do When the Medications Don't Work is his most well-known book, but there's many others. And I've also been studying with Apex Energetics, treating nutritional compounds for treatment of chronic conditions. And I've also been a student of functional neurology, which is the treatment of chronic neurologic conditions without the use of drugs. Anyway, what I want to talk to you today is about chronic conditions, which is what Crohn's and irritable bowel syndrome are. All chronic conditions have some very, very common threads. Irritable bowel syndrome, Crohn's, type 2 diabetes, celiac disease, thyroid conditions, fibromyalgia, chronic fatigue syndrome, neuropathies, rheumatoid arthritis, multiple sclerosis, migraine headaches, and the autism spectrum disorders all have some very common threads. And those threads are that they have, there are always metabolic imbalances involved, and neurologic imbalances. Sometimes metabolic imbalances cause the neurologic problems, and sometimes the neurologic problems cause the metabolic disorders. But it's a combination of these two things that produce all these different chronic conditions. You have to find the right combinations. Now, your metabolism is nothing more than the way your body takes food in and digests it and turns it into energy. That's all it is. Now, what system in your body probably uses more energy than any other? And that would be your nervous system. Your nervous system is about 2 to 3% of your total body weight, but it uses over 30% of all the energy in your body. Now, in order for these disorders to occur, there is a brain-gut connection. Father of Hippocrates said, look no further, you'll find the origin of almost all illnesses in the gut, okay? And it's a very complex problem that goes from gut inflammation through all these processes until it causes inflammation in the brain. It can be very complex. Now, 70 to 80% of your immune system is produced in your gut. If you have a sick gut, you will end up with a sick body as well. That's all there is to it. Anything that causes an immune battle in your gut will trigger inflammation. Food sensitivities, infections, bacterial infections, parasites, molds, fungus, yeasts. We've been seeing a lot of yeasts lately causing these disorders. They all have to be looked at. Now, the big picture, irritable bowel syndrome versus the Crohn's-like disorders. Now, both cause similar problems in the gut as far as symptoms are concerned, but they're both very, very different as to how they occur and what causes them. Irritable bowel syndrome is abdominal pain, fullness, gas, bloating, relief after bowel movements. But 1 out of 6 people in this country have some version of irritable bowel syndrome. All right, and other symptoms, high incidence of headaches, fibromyalgia, chronic fatigue syndromes. And why? Because of a gut-brain connection. When your gut is not working properly, it will cause inflammation in the body, which causes inflammation in the brain. The brain starts to not fire properly because of the inflammation, and then that has a feedback loop to the gut and makes it even sicker. All right, and these are common medical treatments that you will see from the medical profession, but you've got to understand something about medicine. Now, one of these drugs is designed for correction of the problem. It is designed to make the condition manageable so you can live your life with it. These are treating the symptoms and not the cause. Let me explain something to you. I have great respect for medicine when it comes to crisis intervention and emergency medicine. My life has been saved twice by emergency medicine. But when it comes to chronic problems, medicine in this country is nothing short of horrid because they treat symptoms and not the cause of the problem. And when people are given a drug that they have to take for the rest of their life, they are given a sense of security because now they're better, and they're not. These conditions continue on in life and end up causing much more serious problems as we get older. Now, causes of IBS can be linked to infections, abnormalities between the gut floras. Overactive sympathetic nervous system is very big. Brain imbalances is very important because if the brain is not functioning properly, the gut cannot function as well. Disorders of the brain and gut can have major effects on every function of your body. Your brain overfires or is not firing equally from one side to the other, and can make you very, very sick. Now, your brain is a sensory organ, and everything in your brain is perceived. Your brain is one great big receptor, and it perceives the input it gets from the body, and then it tells the body what to do with it. You have many, many receptors that the brain responds to. Muscles, joints, skin, eyes, ears, all these different things. But the two receptors that light the brain up the most are touch and gravity, because your body works against gravity all day long, and you're touching things, you get reception, and you perceive what that is, and then you deal with it. Touch is extremely important for chiropractors, as you can imagine. Now, there are three parts of your brain: the cerebrum, the brainstem, and the cerebellum. Okay, and here's how the brain works. You get sensory input from the body, and it goes to the cerebellum first, and then from there it goes to the opposite side of the brain, and that upper brain has a major connection to the brainstem back down. The brainstem inhibits and keeps stimulation under control with the sympathetic nervous system, and without that braking system of the sympathetic nervous system, a lot of chronic conditions do occur. An overfiring sympathetic nervous system can cause all these different conditions. Fibromyalgia, urinary tract infections, just decreased immune function, making you sick and leaving you more susceptible to a lot of disorders, just because the brain's not firing equally through its different systems. It can also cause problems with blurred vision, increased sweating, getting to sleep, sometimes getting to sleep but you can't stay asleep, dizziness and vertigo. This has been huge in our office lately. High blood pressure, cold hands and feet, sensitivities to light and sound. All right, another part of your brain, which is the cerebellum. This produces a lot of disorders: loss of balance, vertigo, chronic neck and back problems, headaches, clumsiness, dropping things. You ever notice that you're not hanging onto things like you used to, you're dropping things more often? Disorganized thinking, and a lack of output to the upper brain and the cerebrum. Upper brain fatigue can also cause these different disorders: depression, anxieties, difficult scanning pages when reading, understanding what people are saying, decreased memory, lack of focus, and learning difficulties. Also as different sensations in the body. Numbnesses and tinglings like your neuropathies, decreases in handwriting, weakness in the body, lack of motivation, almost feeling depressed and not knowing why. So how does this all happen? How does this happen? There's three different ways it can happen. Chemical, physical, and emotional stresses will cause fatigue to the brain. The brain does not fire properly and sends fewer impulses to the body. The body doesn't work right. Remember, everything in your body works because of your brain. And if the brain's not working, nothing else can. Now, the gut-brain interactions are so intimate that if the gut dysfunctions, the brain dysfunctions. When the brain dysfunctions, everything else dysfunctions as well. Now, the chemical and physical stresses to the brain are innumerable, but the big ones are anemias, blood sugar imbalances, a lot of type 2 diabetics in this country nowadays, and food sensitivities. You've heard about the gluten sensitivities, that can be one of them. Thyroid dysfunctions, prescription drugs. Your statin drugs are causing major problems to the brain and muscles and all the other functions of the body, and hidden infections. But the big thing here is inflammation. Inflammation is the key word, and all these different things ultimately lead to inflammation, which lead to the gut disorders as well as the brain disorders. Emotional stresses to the brain. When you have continual stress all the time, the adrenal glands start firing improperly and start producing too much cortisol in the system, and too much cortisol can cause serious insulin and glucose level problems, and guess what? Then another problem with inflammation, which causes a breakdown to the nervous system as well. Metabolic disorders causing brain imbalances. Here we go. Interestingly enough, the things that cause the neurologic disorders are the same things that cause the metabolic disorders, because your metabolism and your brain are so intimately involved. Remember, your metabolism is nothing more than the food you eat being digested in the gut and being turned into energy. Anemias, blood sugar imbalances, food sensitivities, adrenal problems, thyroid problems, again, inflammation, hidden infections. And hidden infections lead to inflammation, but the buzzword here really is the inflammation. You've got to find out what's causing the inflammation. When you get that resolved, you can fix everything else. Now, how do we find these things out? Proper testing, which is not being done within the medical community. All right? And many of you have been going through tests, and doctors are telling you your tests are all normal. Okay? But there's a difference between how they analyze lab values and how we analyze them. There's two different ways. There are lab values, and the labs put the thousands and thousands of blood tests through every week, and they make a bell curve average, and whoever's in the bell gets to be considered normal. But we're comparing sick people to sick people. There are functional or optimal lab values for human beings, and those are far more accurate and far tighter. The lab values are like this, and the functional values are like this. Here's the values that your medical doctor is looking at. Here's the range that we look at. This makes all the difference in the world, and it can change diagnosis in a heartbeat. So when you're being told that all your tests are normal, here's what the doctors are traditionally looking at as being normal blood sugar. All right? Here are the functional values. You can be a 70. You can be 70 for blood sugar, and they'll say, well, you're fine, okay? But you're not fine. You're hypoglycemic. Thyroid stimulating hormone for the thyroid gland. Every other woman walking into my office has got a thyroid problem, like literally 50%. And this is a serious problem. And they're being told that they're normal, their values are normal. They are not. All right, they're being analyzed the wrong way. So you can be running all the tests in the world, but if you don't read them the right way, if you're letting the lab tell you what normal is, you're going to have sick patients that you don't get better. And I just don't like that. So based on a patient's history, we may run any of the following tests and look at functional values. We're going to look at blood chemistries. There's salivary hormone testing. Then there are other forms of blood tests we do, and in stool ecology profiles if we find that there possibly is gut floral problems or infections. All right, this is the big one. Cyrex Labs, they are in Arizona. This is the preeminent lab in the United States for running the right tests and giving us the right information so we know how to get you better again by getting to the cause of the problem, not treating the symptoms. Okay, in functional medicine, the metabolic treatments are based on lab findings. Some nutritional supplementation is used to support healing. Otherwise, sometimes, if you've got a gut problem and you get the offending agent out, but you don't heal the gut, it takes forever. It can take several years. With the proper nutritional supplementation, we can heal the gut in 4 to 6 months. All right? And those things we're looking to heal are going to be endocrine system, thyroid and adrenals, the gut, liver problems, your anemia, sugar regulation, and autoimmune regulation as well. Now, that's been how we do it metabolically, but we also have to look at the brain imbalances, because if you've had any kind of a metabolic disorder for any amount of time, the brain is not firing properly either, and if we can make your metabolism better all day long, but if you don't heal the brain, you're still not going to be 100%. So both things have to be looked at, both neurologically and metabolically. And there are major things that your brain needs, okay? We need food, and we need activation, okay? Basically, this breaks down into oxygen and glucose and exercise. Those three things together, all right? And if you don't have those three things together, your brain will not function properly. Why oxygen? Well, the oxygen requires, the brain requires massive amounts of oxygen. And of all the air you breathe every day, again, I said your nervous system is only 2 or 3% of your total body weight, but your oxygen consumes 20% of the oxygen. Your brain consumes 20% of the oxygen that your body uses every day. It's incredibly important. Oxygen, nutrition, and exercise. Those are the three things your brain needs, and if any one of those things is low, it's going to cause you serious trouble. So activation of the brain. All these things, unilateral manipulations, oxygen therapies. We use oxygen with a lot of these other therapies. We combine them together. Physical therapies of all sorts. Sound therapies, olfactory stimulation, and eye exercises are very, very huge, and we very frequently have people breathing action while we have them do these exercises. Visual stimulation is huge. Your eyes are the window to the brain, and we can get a lot of exercise into the brain using the eyes. All right, these are more exercises or therapies. We have many, many, many therapies. Depending on what part of the brain we find is dysfunctioning, tells us what part of the brain we need to exercise with oxygen. With Crohn's disease, you've got an inflammatory disease again of the gut, and it can cause all kinds of horrible disorders. The incidence in Crohn's is much higher in smokers than non-smokers, but this is an autoimmune disorder. Smoking doesn't cause it, but smoking will aggravate the daylights out of it, and you've got to get off your smoking. This is an autoimmune disorder. Many times it's diagnosed with colonoscopy and biopsies. And you'll go through exacerbations and remissions because the doctors are going to give you drugs that will do that for you. The symptoms are similar to irritable bowel syndrome, except there's much more inflammation, and you can have a lot more problems like the diarrhea. We have had patients here with Crohn's disease that couldn't even leave the house, get into a car to get to the doctor's office because they were having accidents in the car. It's terrible. Along with this, there could be other disorders as well that go with it. It's not uncommon for Crohn's patients to be diabetic or have peripheral neuropathies or constant headaches or be in depression. You know, if you can't leave the house, I think I'd be depressed a lot too. It's a horrible disorder. It makes a lot of people very sick and very, very miserable. So Crohn's is an autoimmune condition, and it's your immune system mistakenly attacking your body, all right? And here's some of the other conditions that can go along with it. Graves' disease, rheumatoid arthritis, type 1 diabetes. 1 out of 5 people are autoimmune in this country and don't know it. And this could be one of you if you're considering you've got a problem like this. All right, the medical treatment is to squash the symptoms, and that's by suppressing the immune system. They recognize that this is an autoimmune disorder and that your body's immune system is mistakenly going after the gut. But instead of finding the cause of the problem, they go back to treating the symptoms, okay? So they're going to put you on corticosteroids, which just suppresses your immune function. Ultimately, this condition fails, and I cannot tell you how many Crohn's disorder patients have come in here and they've already had sections of their gut removed because the bowel just quit working. So they have to remove it, all right? And over a period of time, you don't have a whole lot of gut to work with. And how many abdominal surgeries do you want to go through? All right, but it does make a lot of nice house payments for the doctors. Now, natural metabolic approaches to Crohn's. All right, you got to remove the triggers. See, what happens is we have genetic triggers in our body that will set these kinds of conditions off. Some people have it for Crohn's, some people have it for rheumatoid arthritis, some people have it for fibromyalgia, some people have it for MS. If you can find what's triggering your immune system to produce these conditions, you get those offending agents out, the trigger shuts down, and you no longer will get the condition. All right? The other thing is we have to balance the immune system. If the sympathetic, parasympathetic systems are not firing equally, you'll have a lot of inflammation because of that. You got to correct the damaging effects on the gut and brain from the Crohn's because that's the way it works. You've got to get everything balanced properly. Common triggers. Look at this, the same things again, the things that are causing these triggers. Food intolerances, smoking, hidden infections, unstable blood sugars, omega-6 versus omega-3 fatty acids, stressed out adrenal glands, and hormone imbalances. And guess what? It's all about the inflammation. All right? How do you find out if this is what the problem is? Again, it's proper testing. Complete blood works, including functional ranges, adrenal stress tests. Frequently we have to run stool tests, and again, Cyrex labs, checking for leaky gut syndrome, food sensitivities, and autoimmunity. If you've not had these tests done, you've not gotten all the answers. And chances are you've not had these tests done because your doctor is still looking to treat the symptoms and not the cause of the problem. All right? Here's just a few of the things we use to get Crohn's disease resolved. Vitamin D, nitric oxide, phosphatidylserine, the omega-3 fatty acids, and other compounds as well. So we got to repair the gut. These are a number of the things we use for repairing the gut. These are all scientifically proven herbals that do heal the gut lining. I mean, there are scientific studies showing how these work, and we use combinations of all these, plus digestive enzymes if needed, and probiotics, which I guarantee you need. It's that important. Once the gut is functioning properly, then we go after the brain. We get the brain straightened out. We get the brain functioning equally from side to side and from sympathetic to parasympathetic systems. Get it balanced out. Otherwise, the brain will start making the gut dysfunction again. Now, what makes us different from all the other doctors that you've seen for this? Well, we're not treating symptoms. First of all, we're treating the disorder itself. We're looking for the cause. Something's causing inflammation. The inflammation is breaking your body down. Your gut's going bad. Now the brain goes bad, and you're sick as a dog. We will leave no stone unturned getting this resolved for you. But you got to work with us because we're going to find the exact cause of the condition and get it straightened out and get the brain functioning properly again. Make you a healthy person. So what's next? Here's what we offer folks when they come to our office. Complete neurologic evaluation, a review of existing labs we're going to have. You bring as many labs in as you've already had. We'll have a number of metabolic and neurotransmitter assessment forms, and we require you be with your significant other, whether it's spouse, girlfriend, boyfriend, because there's so much information, 2 people absorb this way better than just one. If we need to, we'll take x-rays. Don't always have to do that. We'll have you come back. I will review everything, then I'll sit down with you and talk to you about the options we have in helping you get better. We have an extremely high success rate in resolving Crohn's. It's not that hard once you find the underlying cause. And on the second visit, you're going to know exactly what we offer to do. Neurologically, metabolically, we'll give you a complete overview of the treatment plan and review of financial obligations. There's no surprises with us. You will know everything that's coming at you. Again, your significant other must be with you. All right? So, my offer is to come to this office and sit down and consult. And I spend a lot of time just consulting you. If you think this is the right thing for you, you can make an appointment on the spot. We make that appointment, and we'll go over everything, and then we start visit 1 with the examinations and visit 2 with the report. It's as simple as that. You've got to understand that this is something that only gets worse. These do not go away. They get worse and they turn into other disorders. Sometimes there's cancers, sometimes they're Parkinson's, sometimes it's Alzheimer's. But these conditions progress into much worse things later on. It isn't like you got Crohn's disease and now all of a sudden you've got cancer, okay? These things take a long time to evolve from one thing into another. But on a scale of 1 to 10, how serious do you think this illness is? And, is it affecting your relationship, your ability to work? Is it affecting your ability to even get out of the house? On a scale of 1 to 10, how serious are you about eliminating the illness? Due to time constraints, I can't just take everybody in here because I only really want the people in here that are sincerely interested in getting better. And if you're not willing to work with me on this, we're not going to have a good relationship. I want you better. So my name is Dr. Alan Barthen, and I appreciate your time watching this video, but I am very sincere about being able to help you with your irritable bowel syndrome and or Crohn's disorder. Give me a call so we can set up an appointment for consultation. My number is 847-639-0010. I'm right in Cary, Illinois. Thank you.